Um, Good evening, all, and thank you for being with us tonight in the Science Communication Hub Nigeria webinar series. I'm Dr. Hussein Abadisa. I'm a member of Nigerian Medical Association. We are pleased to welcome Dr. Jamil Nikau, a very special guest from Abuja. Dr. Jamil Ibrahim Nikau is a medical doctor and an epidemiologist with the Federal Ministry of Health. He qualified in medicine from University of Maiduguri in 2010, where he had a distinguished undergraduate career, obtaining several prizes, including the overall best graduate medical student, disease outbreak investigation in Nigeria, and had served in National Emergency Operation Centers for cerebral meningitis, cholera, yellow fever, and Lassa outbreak. He is currently working with the National Malaria Elimination Program as a focal person of seasonal malaria chemo prevention. Dr. Nikau is getting partners supporting the intervention, tracking progresses, and helping in mobilizing resources to scale up seasonal malaria chemo prevention. He is a member of subcommittee and technical working group working towards the control of malaria in Nigeria. He has contributed in the development of several malaria case management guidelines and training materials. Previously, he served as a team leader of a state support team for National Malaria Elimination Program that helped several states in planning and implementation of long-lasting insecticide-treated net mass campaigns. Over 10 million long-lasting insecticide nets were distributed in the state his team supported. He is a graduate of Nigerian Field Epidemiology Training Program Advanced Course and has presented in scientific conferences and published papers in peer-reviewed journals. And tonight, he will be sharing with us his first opinion on the pandemic in Nigeria. The importance is to educate the populace on the COVID-19 pandemic in Nigeria and to dispel some misconception about the pandemic. With that, I ask that you give your attention to Dr. Jamil Ibrahim Nikau and help me to welcome him on board. Dr. Jamil, you are welcome.
Okay, thank you very much, Dr. Seni. Also, thank you very much for the kind introduction and for inviting me to make this presentation. As introduced earlier, I'll be presenting on the COVID-19 or the coronavirus pandemic, especially in Nigeria. The main focus of this presentation is what people need to know about the disease and also what to do to prevent its spread. So this will be the outline of my presentation. However, I work with the Federal Ministry of Health, but maybe a sort of disclaimer here. I'm not speaking for the Federal Ministry of Health. I am speaking in my personal capacity as an epidemiologist. So this will be my outline of the presentation. There will be introduction. Then we discuss the epidemiology of the disease, how it has been transmitted, then the clinical features, how those with disease present, and then how the disease is being diagnosed, and then the treatment options, as well as the global and Nigerian response to the COVID-19 pandemic, as well as what to do yourself to protect yourself and also the general community. So the first is introduction. So coronavirus disease, or in short, known as COVID-19, is defined as an illness syndrome by a novel coronavirus, now called Severe Acute Respiratory Syndrome Virus 2, or SARS-CoV-2. It is called a novel virus because it's a virus that was previously not known before this present outbreak. So this is the first time humans or any humans have been infected with this kind of disease. And that's why it's called a novel virus. It is also classified as an emerging zoonosis. Zoonosis refers to a disease that can be transmitted from animals to humans. So emerging zoonosis are so diseases that from animals can infect humans, and which in some cases can even result to outbreak, like this COVID-19 outbreak or pandemic that we have. The first case of this COVID-19 infection was identified in Wuhan city, in Hubei province of China in early December, and then it was reported to WHO as part of the international health regulation requirement on 31st December 2019. And based on some development and spread of disease, the WHO on January 30th, 2020 declared what is referred to as public health emergency of international concern. Also, when it is escalated further, the WHO on the 11th of March 2020 declared the COVID-19 as a global pandemic. We will get to know what those terms mean. So what is this coronavirus? A virus is a sort of microorganisms. Microorganisms are sort of small creatures. Most of them cannot even be visible through the naked eyes. And virus is one of the smallest forms of microorganisms. So what are microorganisms that we have? We have bacteria, we have parasites, we have fungi. But virus is one of the simplest microorganisms. In fact, it's an organism that on its own, it can replicate. It can't reproduce on its own. So it needs other cells to replicate. It can infect humans, other animals, and even plants, and can also even infect other microorganisms and or even other viruses. Coronavirus belongs to a family known as coronaviruses. There are several viruses in this family, and they are common in both humans and animals. It causes disease in both humans and animals. But there are some specific coronavirus that cause disease in animals and some that cause disease in humans. However, most diseases in humans are usually mild disease. Most cases, usually upper respiratory tract infection. The name corona is from the Latin name crown, because if the virus is looked under a microscope, it has appearance of a crown. It has some spikes on the head that look on the surface that look like a crown. So on electron microscope, and that's why it is referred to as coronavirus. And then rarely, in some cases, animal coronaviruses that usually affect animals can infect humans and then spread to people, and then spread between peoples. Examples are the MERS-CoV. The MERS-CoV refers to as Middle East Respiratory Syndrome virus, coronavirus, and then the SARS, Severe Acute Respiratory Syndrome virus, and now with SARS. So MERS-CoV and SARS-CoV causes some outbreak in the last SARS-CoV 2012 to 2013, 2002 to 2003, and then MERS-CoV usually mostly in the Middle East. It caused outbreak in Middle East, part of Saudi Arabia, United Arab Emirates, and now we have SARS-CoV-2. The first SARS is called SARS-CoV-1, while the present novel virus is called SARS-CoV-1. That's the causative agent of COVID-19. The SARS-CoV-2 virus strain was previously known as the 2019 novel coronavirus, and then some people also call it the Wuhan virus or the Wuhan coronavirus. However, the WHO renamed it to Severe Acute Respiratory Syndrome Coronavirus 2. Because in the presence of nomenclature or naming of viruses or other microorganisms or diseases, the WHO usually avoid the use of some places because of the stigma attached to it. For instance, if the virus is named after Wuhan, so whenever somebody comes to Wuhan, we'll be thinking that he may be infected with the virus. So now the name of the virus is SARS-CoV-2. And then initially, based on some certain investigations, the virus there's some thinking that the virus is from bats, animal bats, and they are the most likely natural reservoirs because the virus resembles some of the coronaviruses that infect bats. Initially, I mentioned zoonosis. So in zoonosis, that is what is called emergent zoonosis. And emergent zoonosis are defined as zoonosis, that is disease that that usually affect animals, but can affect humans, that is newly recognized or newly evolved, or that has occurred previously but shows an increase in incidence or expansion in geographical host or vector range. So basically what it means is that there are zoonoses that has somehow changed, or maybe it's either a new zoonosis that is not previously known, or something that is known, but it has the strain of the zoonosis, the microorganism. Zoonosis can either be caused by bacteria, viruses, fungi, or other microorganisms. It has changed the strain and it becomes more infectious or more deadly. So there have been so many factors that have been responsible for emergent zoonosis globally. One of it is the alteration of the environment. If you know, with the presence increase in the global population and increase in human activities, there are a lot of destruction of natural habitats of animals. There are road construction of bigger projects, dams. So with that, some animals will be disrupted from where they are living, and they may likely have got in contact with humans. And with those contacts, they may likely infect humans with their microorganisms. Example, like the coronavirus. We have also some bacterial infection, bovine TB. There are a lot of zoonosis. And then there's also the industrialization of foods of animal origin. In the world now, there are so many industrialization of foods. So during the process of those foods, there's a possibility that some of these animals are infected. The disease they have can be transmitted to other humans in the process of processing of food. And then we have increased movement of people. People nowadays, because of increased ease of movement, somebody can have breakfast in Nigeria today and then eat his lunch in the UK, and then can proceed then same day to America or to some part of Asia. So with that, if he's having a disease or is incubating a disease, he can share it with those people in all the places he's visiting. And that's why in epidemiology, it's been said that the next outbreak could be one flight away, because once somebody is infected, once he's in a flight and the disease is very infectious, he can easily transmit it because of ease of treatment. And then there is also genetic changes of the agent. And some agents, naturally, microorganisms, bacteria, or especially viruses, they replicate rapidly. And during the process of replication, some of their genetic makeup changes. And when those changes of genetic makeups, it can affect their infectivity. Some becomes more infectious, while others become less infectious. And then we have new diagnostic possibilities. Before, there are some diagnostic methods that are available. So even though there may be some zoonosis that may be transmitted from animals to humans, but because we don't have the ability to diagnose them, we will not be able to diagnose them. But with so many diagnostic opportunities, so we can diagnose so many diagnoses. So the most important thing now is to have what is called One Health approach, and that's why the WHO, that's World Health Organization, and then the Food and Agriculture Organization, as well as the WHO, or the World Health Organization of Animals, coming together and develop what is referred to as One Health, so that all aspects of health, be it for human or animal, it can work together, so that at the end of the day, we can achieve a common good, so that diseases of animal origin cannot infect humans, and even if we are infected, it can be mitigated easily. So now, there are some terms that we usually say it loosely, but it's very important for us to have a definition of what those terms are. There's the first term I want us to define is epidemic, or otherwise known as outbreaks. So outbreaks refers to as the occurrence of a disease or injury or any other event that is more than the expected in a given population or in a specified group of persons during a particular period. Usually, the cases are presumed to have common cause or to be related to one another in some way. So example is this coronavirus. Initially, it started in Wuhan, part of China. Most of the people there are the ones, and then these cases, because it's abnormal, the health authorities there inform the Chinese government, and which in turn inform the WHO that there is an unusual occurrence of disease. And for outbreaks or epidemics, it doesn't have to be a disease. In the definition by the CDC, which I just read, they said health condition or health event. It can be other health events like obesity or like diabetes. So it's no longer restricted to infectious diseases. And then initially, COVID-19 was designated as a public health emergency of international concern. What is this PHIEC? Is defined under the International Health Regulation 2005, which is like a legal instrument that has a legal binding for all countries to report all cases of all infectious diseases that has the ability to cause that to spread between countries, and which requires coordinated and international response. And then the last item I want us to define is pandemic. What is pandemic? Usually, outbreaks, in most cases, they're usually localized in one place. Let's say you can have an outbreak of cholera in some part of the country, maybe in Borno State, or maybe in an IDP camp in FCT, or maybe in Kano State. But pandemic refers to an epidemic occurring over a widespread area, usually multiple countries or continents, and usually affecting a substantial proportion of the population. So an epidemic is a pandemic It's an epidemic that usually spreads across so many countries, like what we are experiencing in the COVID-19 outbreak. This is not the first pandemic that we have in the world. There have been several pandemics. In recorded history, the most deadly pandemic occurs between 1347 to 1361, known as the bubonic plague or the Black Death. It was caused by a bacteria known as Yersinia pestis, and it was responsible for the death of at least 200 million people, mostly in Europe. And it was believed to have wiped out about 30 to 50% of the European population. Another pandemic of interest is the Hispanic influenza or the Hispanic flu that occurred between 1918 to 1919. And so many experts are drawing some comparison between the Hispanic influenza or Hispanic flu with this COVID-19 pandemic. It happened roughly about 100 years ago. It was responsible for about 40 to 50 million deaths. And then there's one ongoing pandemic, even though it's very slow, but it has very significant morbidity and mortality, which is the HIV and AIDS pandemic, which was the virus was discovered in 1981, and is believed to have estimated to kill up between 25 to 35 million persons, and it's still ongoing. So many people are infected with HIV, and people are dying from HIV every year. Another pandemic of interest that I want us to discuss is the mass pandemic caused by coronavirus between 2012 to up to present, because up to now there's some recorded cases of mass COVID, and then we have the SARS pandemic between 2002 and 2013. So there have been several pandemics around the world, but this one is one of the pandemic. Is in fact from the since the Hispanic flu of 1918 to 1920. There have not been any pandemic that have widespread ramification like this COVID-19. So now let's discuss the epidemiology of the COVID-19. So epidemiology refers to actually who is infected, why he's infected, and then the when he's infected, and then also the determinant of the disease. Why is he infected, and how is he infected, and then what else? What does having all this information will help us in controlling the disease condition? So how does this COVID-19 pandemic started? As I mentioned earlier, the WHO was notified in December 31st of pneumonia of an origin in Wuhan. And initially, most of the patients that were affected in the outbreak have some linkage with seafood market and live animal markets in the city of Wuhan. But however, upon further analysis, it was found that one of the earliest known persons to be affected with the COVID-19 was in this 1st December, and that person didn't have any connection with the livestock market. So this is a timeline that was developed by the WHO Afro region for the key activities that happened during the COVID-19 pandemic. From the notification of WHO in 30th December 2013, and then on the 7th of January, Chinese scientists were able to isolate the virus from infected persons, and then on the 12th of January 2020, they shared the sequence of the novel coronavirus to the rest of the world. This is very significant because first you need to know what is causing the disease. Initially, it was thought to be a viral infection, but first the virus had to be isolated. And after the isolation of the virus, the genome of the virus has to be sequenced. So with the sequence of the virus, all the genetic materials of the virus will be known. And with that, it will be easily for Chinese authorities and other countries to develop test kits that will be able to detect the virus. And the Chinese were able to share this virus to the world so that any country can prepare and develop test materials as early as the 12th of January. And then the first imported case of coronavirus outside China was in Thailand on 13th of January. And since then, the cases escalate. And by the 28th of January, there were about 7,800 confirmed cases with about 270 deaths. Because of that, the WHO IH committee, they meet, there is an international experts that IH committee that met, and then advised the WHO Director General to declare it as a public health emergency of international concern. And with that, there were some escalation of public health interventions. There was the EOC, Emergency Operations Center, was set up in WHO that coordinate response globally. The first confirmed WHO case in Africa was in Egypt on the 15th of February. And then in Nigeria, our first case was in the 28th of February. And since then, and by March 18th, about 181 countries have been affected. And by 24th of March, about 42 labs in Africa, or the WHO Africa region, have the capacity to diagnose the COVID-19. So this is the distribution of the COVID-19 pandemic globally. If you can see, virtually all countries of the world have been affected. The orange dots represent the number of cases. The bigger the dot, the higher the number of cases. So far, the cases are usually higher in Europe, and then China, and then in the United States. And this represents the duration of when this virus started getting circulated in those countries. Regarding the numbers, so far, the last time I checked, about 1 hour ago, there are about 837,115 confirmed cases, and about 213 countries and territories have so far confirmed the coronavirus. Only a few countries, I don't think there are up to 20 countries that have not reported cases of coronavirus. And so far, there are more than 41,000 deaths. And regarding new cases, in the last 24 hours, about 50,000 cases were added. So these countries represent the countries that have the highest number of cases. So far, the countries that have the highest number of cases is United States of America, followed by Italy, Spain. Before, it used to be China, but because of their control efforts, they've been able to scale down the number of infection. Like yesterday, China only recorded 79 cases of COVID-19 virus. Other countries that are worst affected include Germany, France, Iran, United Kingdom, and Switzerland. So this the distribution of cases by the WHO region. WHO have what is called a region, CISC region in the world. We have the Africa region, the Eastern Mediterranean, and other part of the countries. So first of this region, and then this is in statistics referred to as a histogram. So it represents the number of cases by geographical area, or by the number of cases by the duration of onset. If you look at it, there's an explosive spread of the virus. When it started in December, and then it started increasing rapidly. The green part represents the number of cases in China, while the orange part, number of cases in Europe. The pink, or the purple side, is the Eastern Mediterranean, so part of Asia, and then China, and then Africa is the dark green area. So in Nigeria, the first case of COVID-19 virus was confirmed on the 27th of February, and then the index case, that means the first case that came to the notice of the health authorities, was a 44-year-old Italian that arrived in Nigeria some few days before the diagnosis. He arrived in Nigeria from Italy, from Milan, city of Milan, from Italy. And since then, number of cases started, increasing exponentially. As at 11 a.m. Today, that's 31st of March 2020, there are about 105 confirmed cases, and so far, 2 persons have died from the infection. However, most cases of COVID-19 in Nigeria are usually mild to moderate. A total of about 6,238 passengers of interest have been identified and have been monitored by the Nigerian Center for Disease Control in collaboration with the epidemiology unit of Virus Study Ministry of Health that have cases. So regarding the distribution of cases in Nigeria, about 12 states are so far affected. We have a total of 135 cases. Lagos State is the state that has the highest number of cases, followed by with recording 81 cases so far, and then FCT have 25 cases. The COVID-19 pandemic has spread in Nigeria. So far, all the 6 geopolitical zones in Nigeria have at least a state that has COVID-19 pandemic. With the list with the Benue, which has 1 cases, and River State with 1 cases. But however, it has been thought that those cases, the content of those cases have been monitored by the Nigeria Center for Disease Control, and those that are symptomatic will be tested to see whether they have the virus or not. Then, why is the virus important? So, as I mentioned earlier, the COVID-19 virus is very infectious. It's easily spread. In fact, the spread of COVID-19 is one of the viruses that has the highest infectivity. And in epidemiological terms, they say that the basic reproductive number, or the R0, is high. It is more than 1. It can be up to 3 for COVID-19, which the basic reproductive number represents the number of persons an infected individual can spread. Usually, if the R0 is less than 1, that means the disease cannot be spread. And the higher the R0 away from 1, that is, maybe it is 2, 3, the more easier the virus can be spread. So another reason why the virus is very important is that it has significant morbidity and mortality. So even though the number of, usually most of cases of COVID-19, about 81% of COVID-19 cases are mild to moderate, or in some cases even asymptomatic, only about 19% of all cases require admission. And in those cases that require admission, only about 4% requires ICU, or intensive care unit, and some of them will require even respiratory support with ventilators. So far, the case fatality rate for COVID-19 is about 4.67, or close to 5%. That means for every 100 patients, for every 100 persons that are infected with COVID-19, about 5 of them will die. But the worst fatality rate, and case fatality represents the number of persons that are infected, the number of cases, persons that are infected, number of the death among the number of persons that are infected. So let's say if there are 10 persons that are infected, and then 2 of them died, so the case fatality rate will be 2/10. That means about 20%. So for COVID-19, globally it's 4.7, but in some countries it's higher. Italy has the highest case fatality rate of about 11.3%. And so far, Italy has the highest number of persons that died from the COVID-19 pandemic, even though the disease is spreading in so many countries around the world, as I mentioned earlier. So one of the significant effect of COVID-19 is that it can overwhelm the health system. Like if you are watching the news, international news, most countries that have been hit harder by the COVID-19 pandemic, usually the health system is overwhelmed. So many cases, the hospitals are inundated by so many cases. Like in China, in February, they have to set up an emergency makeshift hospital, so that to accommodate so many patients that will require hospital care. With that, so many persons that will not have COVID-19, maybe they have other health problems, maybe diabetes, hypertension, or infections in children, will not be able to access care in the health facility, and this will also add to the mortality of the COVID-19 pandemic. And especially in Africa, where our health system is weak, and already, if you go to most hospitals in Africa, especially in Nigeria, in most cases, as part of the times, there are lack of bed spaces. So imagine if you have large outbreak of COVID-19, so the health system will be overwhelmed, and even the normal services that are being rendered by these health facilities will be very difficult. And if you remember the Ebola outbreak that affected Sierra Leone, Guinea, and Liberia, and some part of West African countries, it has really destroyed the healthcare facilities. And after the outbreak, the healthcare system had to be rebuilt. So these are one of the effects of the COVID-19 pandemic. And then the last point is that it has disrupted human activities globally. With the COVID-19 pandemic, a lot of human activities has been restricted. Like in most countries, they have suspended air travels. So many cities, about several hundreds of millions of people are in lockdown, so they can't go anywhere apart from emergency services. So so many economic activities has been suspended, And so many industries, especially aviation or the hospitality industries, hotels, travels, mostly are worst hit. And it, based on some estimates for some economics, there are so many countries will be bankrupt. So many companies will be bankrupt after the COVID-19 pandemic. So regarding the severity of infection, as I mentioned earlier, most cases of COVID-19, about 81% of them have either no symptoms or mild symptoms, usually uncomplicated. So about 40% of those symptoms have severe disease that may require hospitalization, and then 5% will require ICU care. So regarding people at risk, the people at risk, mostly at risk, are the elderly, and then the persons with pre-existing condition. We'll see later in the next slide. So with regards to the persons with pre-existing condition, pre-existing or the age group, the elderly are the one of the age group that are at risk of having severe disease. So this data was compiled by a website known as Our World in Data. So they did some analysis on the COVID-19 cases in China up to 11th of February 2020. And based on that, most of the death that happens, the case fatality rate occurs in persons in the elderly. So if you look at it, for persons children between 0 to 9 years, the mortality rate is 0. And then from those from 10 to even 39 years, the mortality rate is about 0.2. That means in every 1,000 persons that are infected in those age groups, only about 2 persons will die. However, from the age of 50, the mortality rate started increasing. And by every 10 years, it will double. Like from 50 to 59 years, it's 1.3, and then it increased to 3.6 for persons age 60 to 69 years. And then for persons age 70 to 79 years, the mortality rate doubled to about 8%. And then for persons older than 80 years, the mortality rate is about 15%. That means it's doubling after the age of 50 years. So the elderly are worse at risk. And if there are some people, if there's some age group that should be protected from this COVID-19, is the elderly, because they have the highest, not just mortality, but even severe illnesses, longer stay in hospital, admission in ICUs, and use of ventilators. So regarding pre-existing condition are health conditions that the person will have before having the disease. Like based on the information from China, people with no health condition, they have their case fatality rate, that's the lower one. The case fatality rate is about 1%, 0.9%. So if somebody is not sick, doesn't have any underlying condition, so he has only 1% chance of dying. However, if the person has some pre-existing condition like cardiovascular diseases like myocardial infarction or coronary artery disease, the case fatality rate for this age group increases to about 10.5%. Those with diabetes, 7.8%. Also, those with chronic respiratory diseases, hypertension, and cancer have increased case fatality rate. So now, how is this virus transmitted? So far, based on available information from places that have infection, the infection is transmitted by respiratory droplet. Usually, the virus is transmitted either person to persons for symptomatic individual, or in some cases, even asymptomatic individual can spread the virus, or sometimes the droplet that's been dropped by the person that are infected can contaminate surfaces, and and then an individual can be infected. So between so the respiratory droplets are small quantity, like quantity of the virus that when somebody that is infected. And one of the cardinal features of the COVID-19 is a respiratory virus. And the respiratory virus, usually the symptoms that are common respiratory symptom is cough. So the person will be coughing. So as he's coughing, he'll be coughing out some of the virus in the droplet. And then droplet contain the virus in the air. And some person that are between 1 to 2 meters, the person with somebody that's infected with coronavirus, the droplet can reach him and he can get infected if he's not protected. And also, when he's coughing, the droplet can land on some surfaces, maybe tables or chairs or door handles, or maybe if he uses his hand during when coughing, when he touch any other surface, the virus can stay there for some hours, 2-3 hours, and anybody that touches thereafter can be infected if that person touches his face or any mucous membrane, that the virus will have the ability to enter his system. So the incubation period. So the incubation period refers to the period between the exposure of the virus and manifestation. For example, if somebody has coronavirus and when he coughs, and then maybe somebody inhaled some of the aerosol that has the virus, that person will not start manifesting until after the incubation period, because the virus needs to stay in that person and replicate for some time before it starts having effects. And usually it's between 1 to 14 days. 14 days is the highest number of days the person that's infected will manifest with symptoms. However, there are some individuals that are asymptomatic that can also spread the virus. And then during the duration of virus RNA detection, so for the people that are infected, the virus will be detected in them about 14 to 28 days after the infection. So now if they get infected today, so they will still be releasing the virus for about 17 to maximum 17 to 28 days. However, the longest for individuals that died with the virus, most of them have the virus in them up to the time of death. But the longest observed duration of virus shedding in individuals that have survived the virus was up to 37 days. So that means for 37 days, the person has the virus and he has the ability to infect other persons with the disease. So whenever somebody is infected, so one has to be people have to be very careful, so that even though he may not be asymptomatic, he may be releasing the virus, which if somebody have come in contact with, he can transmit the virus. Then we have what is the degrees of transmission. The WHO give guidance of there are some 5 degrees of transmission. We have the community transmission, local transmission, imported, under investigation, and interrupted. So the community transmission is when, or let me start with the local transmission. Local transmission is, let's say, if there's an imported case, like in Nigeria on 27, and then that person that came with the virus to Nigeria, he infects some people. So if all the people that he infected can be identified, and no any other case of the virus is not in the country, so that person, the source of infection is local. And then there is imported case of coronavirus, like in Nigeria. Any country that doesn't have like the primary source of infection, China, so the virus are infected. And then the next stage is under investigation. So sometimes if people are not sure whether the virus is imported or whether it's local transmission or there's community transmission, the virus will be under investigation. And then the next or the most difficult stage is when there is community transmission, and it's evidenced by the ability to relate confirmed cases through by the inability to correlate confirmed cases through chains of transmission for a large number of cases, or by increasing positive tests through sentinel samples. So in these cases, or like local infection, some case of COVID-19, when there is community infection, cannot be traced to the source. So in these cases, it donates that so many people are spreading the virus, and the virus is so under control. And when the virus is controlled, then we can say that the virus has been interrupted. Then that means there is interrupted transmission. If maybe in some area or some countries or some state, they have disease and they've been able to manage the spread of disease, and all the persons that are infected have become cured. So in those cases, in those areas, the virus are interrupted. So what are the clinical features of disease? Usually, the main features of coronavirus infection are fever, cough, and difficulty in breathing. These are the main symptoms. About 88% of people that are infected come with fever, and then which is followed by cough and difficulty in breathing. However, there are some category of persons that are asymptomatic. In Nigeria, if you look at, if you are hearing the news, some of the persons that are infected, they will say that they are not having any symptoms. So these are asymptomatic, while some will have mild symptoms. But in severe cases, it can be complicated by what is called acute respiratory distress syndrome, or sepsis, or septic shock. And in some cases, it can also lead to some organ failure. It can affect the kidneys and lead to kidney failure, medically referred to as acute kidney injury, or it can affect heart and then referred to as cardiac injury. So what is the case definition of coronavirus? So it's not all cases of coronavirus. It's not all during where, like in any outbreak, there is what is called case definition. So case definition is criteria that has to be met for somebody to be said to have infection. So there are three stages for the case definition. We have suspected case, probable case, or confirmed case. A suspected case are usually persons that come with respiratory symptoms, maybe fever, cough, or respiratory breathing, and have contact with some person. And then confirmed case are persons that are usually confirmed after testing to have the COVID-19 infection, irrespective of either clinical or either they have clinical signs or they are asymptomatic. While probable case are cases that are said to be inconclusive after testing. It is not clear whether it's negative or confirmed. So it's referred to as probable, and then it will be treated like a confirmed case. So who is a contact? If you are hearing the news by NCDC or in the media, they'll be saying that they are tracing contacts. So who are the contacts? A contact is a person who experienced any of the following exposure during the 2 days before and 14 days after the onset of symptoms, during the 2 days and the 14 days, between 2 days and 14 days after the onset of symptoms of a probable or confirmed case. So if the person have face-to-face contact with a probable or confirmed case within 1 meter and for more than 15 minutes, because earlier we said that a person can only infect if it's within 1 meter of the infected person, and then if there's direct physical contact with the probable case, and then if there's direct care, if the person is giving direct care to person with a probable or confirmed case, or other situation as risks as indicated by local risk assessment by the country. For confirmed asymptomatic cases, the period of contact is usually measured between 2 days before the infection and 14 days after the date which the sample was taken for confirmation. So for all probable and confirmed cases, there is what is called viral contact tracing. All their contacts we defined earlier will be traced, and then they will be asked to remain on self-isolation, and they will be monitored for 14 days to see whether they have symptoms or not. And then if they have symptoms, they will be tested, and then if they're tested, they will be treated as the case may be. And then their contact will also be traced, and then follow the same procedures. So diagnosis. So diagnosis refers to the testing that is done to confirm whether somebody has COVID-19 or doesn't have the infection. So usually for COVID-19, it's not something that can be diagnosed clinically. Clinical diagnosis refers to diagnosis without a lab testing, and it's not all the lab testing that it's all any lab test that can detect coronavirus or the COVID-19 that caused the corona pandemic. For the test in Nigeria, the standard method is testing is real-time reverse transcript test, polymerase chain reaction, or the PCR. It's a specialized test that detects the genetic or the DNA or the RNA of the genetic material of the virus. Because as we mentioned earlier, the genetic sequence or the genetic material of the virus has been identified. So the testing method identifies specific genetic material related to the coronavirus that is causing the pandemic, so that there won't be contamination, because there are other coronaviruses and there are other tests of determine whether somebody has coronavirus or not. So this test detect precisely the coronavirus that is causing the pandemic. So regarding the samples that is taken, the samples taken are usually respiratory samples. This picture depicts a health worker trying to take a sample from one person that is suspected to have coronavirus. So it's respiratory cycle. It's called nasopharyngeal swab, and they will use a swab stick, and then you are put it in the nose of the person to go deep down and take some swab, and then it will be examined in the lab. So, and then results are usually available within few hours to 2 days, depending on the lab and then the workload on that lab. There have been some rapid diagnostics that were developed for coronavirus, but so far have not been approved by NCDC. So in Nigeria, the only means of diagnosing coronavirus is PCR, and this is what is recommended by WHO, because other diagnostic methods are not specific, and there may be mistakes, and they may be false negative or false positive. Somebody that doesn't have the disease, the test can categorize him having disease, or somebody with disease, the test will say that he doesn't have disease. Or however, the PCR is almost certain. If you have the disease, the testing method will identify you. And then in China, at the point when they were overwhelmed, they started using CT scan, but later on they stopped using the CT scan and reversed back to the PCR testing. So far, the only recommended testing method is the PCR. So who can get tested? So according to the Nigeria Center for Disease Control, only 3 persons can be tested. So anybody with travel history, somebody that traveled to part of the world that have coronavirus, maybe Europe or China or other part of the country world that have coronavirus, and presented with fever, cough within 14 days, or somebody that has symptoms and contact with confirmed cases. Maybe there's confirmed case in Nigeria, and then somebody that has contact with him, we define what contact is, and has symptoms, so that person can also be tested. And then anyone with fever and either cough, difficulty breathing, or shortness of breath in an area with moderate or high COVID-19 prevalence in Nigeria, maybe in Abuja or in Lagos, that person can also be, would know any other explanation that will be the cause of the cough or fever, that person can also be tested. So in Nigeria, there are 6 laboratories that are testing the coronavirus in Nigeria as of 27th of March 2020, and another 6 labs. The NCDC is working with states to also set up another 6 labs that can in other part of the country, so that they can start diagnosing the coronavirus, because we expect that gradually, as people are moving, the virus will spread to other part of the country, and the more nearer a lab is to a state, the easier for that state to start testing and control the disease. However, so now how can one, if you have symptoms and you have contact with somebody that has coronavirus, how do you get tested? You only get tested through either the NCDC or the state, by the state. All states have Ministry of Health, and the Ministry of Health, they have a unit called the State Epidemiology Unit, and headed by a state epidemiologist. So that person is the only person that have trained individuals that are working under him that can collect samples from you if you meet those case definition. Because those state epidemiologists and NCDC have been inundated with so many calls with people that want to get tested for the coronavirus. However, for you to be tested, so that we will not be wasting the testing kits because they're very expensive, you have to meet those criteria, case definition, before you be eligible for testing for the coronavirus. So regarding treatment, so far there's no treatment that's been proven to be effective against coronavirus. Like viruses, bacteria usually have some antimicrobials that are effective. But because this is a new virus, so far there is no any effective proven medicine for COVID-19. However, because most of the affected individuals either are asymptomatic or have mild and moderate symptoms, so the mainstay of treatment is to give supportive treatment to alleviate the sufferance. If somebody is having fever, you give him antibiotics. If somebody is having difficulty in breathing, he'll be given oxygen or any other help, as the case may be. And then vital organ function should be supported in severe cases. Let's say if somebody is having kidney failure, he can undergo dialysis. And then somebody with having respiratory difficulties, he can be admitted into ICU unit and then be placed on ventilators. So because of lack of effective treatment for the COVID-19, the WHO has launched a testing a group known as Severity, which is a giant multinational trial for testing therapies that researchers have suggested may be effective against COVID-19, so that it generates robust, high quality, and evidence as fast as possible. Because of the number of the magnitude of the infection, so many people are getting infected, so many people are dying. So several studies are going on. And so there are some candidates that have been tested. Usually we have some antivirals, drugs working on virus, like remdesivir, ritonavir, and then we have anti-malaria chloroquine that was used for the treatment of malaria in Nigeria and other part of the country. Several studies are going on to see whether the drugs are effective. But so far, the WHO have not recommended any medicine for treatment of COVID, because no medicine has been found to be effective in the treatment of coronavirus. Like for chloroquine, in France, there have been studies with a few number of patients, about 40 patients, and those studies found it to be somehow effective in treatment of coronavirus. However, the WHO recommend that further studies or further trials should be conducted to determine whether it's really efficacious or not. Because when there's a disease, sometimes the treatment can also cause harm. So it's very important to test those medicines to see whether they're effective or not before we recommend it to individuals. A word of caution is that chloroquine is something that can be found in pharmacies, especially in Nigeria and South Africa countries. So it's not recommended for treatment. And unfortunately, when people started talking about chloroquine last week, some people took some chloroquine in Lagos State and have some chloroquine toxicity. Whenever there's evidence that chloroquine is working, it will be announced through the proper channel, either WHO or the NCDC. And with that, those people that are infected can be treated with chloroquine. So far, but for now, there is no need for us to to panic and start taking chloroquine, which can be injurious. In the United States, it has been recorded that some families, in one family, one person died, and then his wife was admitted in critical care because of chloroquine toxicity. So far, because of lack of effective medicine, so avoidance is the principal method of deterrence. So the most important thing for now is to avoid getting infected because there's no cure. So vaccines, another thing that usually bring down the effect of outbreaks is vaccine. So vaccination is one of the effective ways for preventing diseases, and it has responsible for reduction of so many diseases in the world, referred to as vaccine preventable diseases. And that's why in Nigeria and other parts of the countries, children, when they're given birth, they will have some vaccination schedule, which has been proven to reduce vaccination, to reduce infectious diseases. And also during outbreaks, for diseases that have non-vaccines, vaccines would rapidly reduce the intensity of the outbreak. Like if there's a measles outbreak, or if there's yellow fever outbreaks, there are effective vaccines against those diseases. So if those people that are around this outbreak area can be vaccinated, it can reduce the intensity of the infection or the outbreak. For COVID-19, so far there's no effective vaccine for COVID-19. However, so many studies have been going on, and so many trials have been going on to see whether we can, whether there will be an effective vaccine for COVID-19. And the WHO estimates that a vaccine cannot be expected in less than 12 to 18 months. So even though the outbreak is, the pandemic is going on, and we hope that it will end as soon as possible, but there are some projections that think that the outbreaks will continue for more than a year, or some even for 2 to 3 years. So if the outbreak has not abated, and we have a vaccine in maybe 12 months, it can be used to protect people from vaccination. Also, there are some discussion, and then some studies have been going on to see whether the BCG vaccine that is given usually for children at birth, whether it's protective. There are some studies, even though no detailed studies have been conducted, has been shown that people that have BCG somehow have less severe disease for COVID-19. So, but so far, this one needs to be investigated with thorough studies. So, what are the global response? So, for WHO, the objectives for the COVID-19 pandemic is to interrupt human-to-human transmission, because if there's no human-to-human transmission, less people will be infected, and then the mortality rate would drop. And then to identify, isolate, and care for people that are infected early. The earlier a person is giving treatment or supportive treatment, the earlier the better its outcome. And then to identify and reduce transmission from animal source, and address other crucial unknowns like vaccination, like whether the infection can be transmitted airborne, or whether that we can have other drugs that can be treated that can be used for the treatment. So for COVID-19, the priority now is given to drugs that already existing drugs like chloroquine, like other antiviral drugs, some HIV drugs, or some drugs that were developed for Ebola, because already some of the properties of those drugs are known, the pharmacokinetics or the pharmacodynamics of those drugs are known. So priority are given to those drugs, because if we rely on the development of new drugs, there are so many phases, and it will take so many years before those drugs can be approved. Other key strategies for the response is communicating critical risks, and then to minimize social and economic impact through multi-sectoral partnership, the economic implication, social implication, and other implications that may result. So the main goal for this for COVID-19 is to see how we can reduce infection. As we can see, the healthcare capacity of so many countries is being overwhelmed, and if so many people are getting infected, the healthcare facility will be overwhelmed, and then will not be able to provide care to those infected. So, and that's why this concept of flattening the curve was developed by the U.S. Center for Disease Control, that's CDC, to see that if the rate of disease or infection can be reduced to a certain degree, it will give the ability of our health systems to cope with the disease, so that even if more people have the disease later on, the health system will have the ability to manage those diseases. So the red area represent areas where there is no any protective measures. Maybe if there is no any measures to prevent the disease, so within short period of time, so many people will become infected, and this is the healthcare capacity. So the healthcare system cannot manage the disease. However, if there are some protective measures, even though the period of infections would be longer, but there would be the health system will have the ability to manage those diseases. So the main aim now is to see how we can flatten the curve, the epidemic curve, so that less people will be infected, and then the people that are infected will have a chance of getting good quality treatment in the healthcare system. So in any pandemic, the strategies for the control of that pandemic are usually 2 or 3. The first one is containment. Containment is usually when it's not widespread. Let's say in Nigeria, if we have some, like Nigeria currently, we have fewer cases, and most of these cases have been traced. It can be traced to the person that imported the disease. So if we can have all the diseases, and we can trace all their contacts, like the NCDC is doing, so we'll be able to contain the disease. However, when we have widespread community spread, and when there are some people that are having infection, and we cannot explain why they're getting the infections. So with that, containment strategies will not work, and we need to use what is called mitigation. And mitigation strategies, usually the measures are usually far-reaching, which may include lockdown, suppression of so many economic activities, closure of offices, restriction of movement, and other activities, as we've seen in China. Like in China, for more than 2 months now, they're in lockdown. People are not going out unless they have some essential needs. And these strategies have been adopted in Europe and in America. And even Nigeria, some cities, particularly Abuja and Lagos, are in lockdown. The lockdowns commenced yesterday by 4 p.m., as announced by the president, so as to limit or to mitigate the impact of the infection. The aim of the lockdown is usually for some days, so that those people that are infected will be identified, their contacts will be monitored, so that the general population will not be at risk. So in Nigeria, these are the responses so far been conducted, and emergency operation centers have been activated in NCDC and in states that have cases. A presidential task force has been constituted, and also a rapid response team have been deployed to affected areas, identification and equipment of isolation centers, and then also testing centers have been set up. And so far we have 6, and then 6 are coming. So many measures like the shutting down of school, closure of land and sea borders, and then mobilization of resources from public and private sector. So many philanthropists have been mobilizing resources to see how we can build up our response plan, how to increase surveillance, how to do contact tracing, equip health facilities, train health workers, as well as build makeshift isolation centers so that we can manage the outbreak. So now the last component of the presentation is how can you protect yourself and help in containing the outbreak. This is the most important thing. The government can do something at the general level, but we'll also do something at our own level to see how we can protect ourselves and also immediate empowerment to help in containing the outbreak. So because of this, the NCDC launched what they call Take Responsibility campaign, so that everybody should take responsibility of its action. Because if if everybody takes responsibility, everybody adhere to rules, the rate of infection will reduce, and then there may not be need for the infection or this will reduce drastically. So there are six things to do. The first one is hand washing. You wash your hands frequently with soap and water, or use alcohol-based sanitizers. Washing hands, because washing hands, especially if you don't, usually hands what is used to transmit the virus. Maybe if you touch areas or you touch somebody that is infected, and use your hands to touch mucous membrane, you'll be infected. But however, if you wash your hands with hand sanitizers, alcohol-based sanitizers, or with soap, the virus will, you clear the virus from your hand and will not be likely to get infected. And then if somebody is coughing or sneezing, especially infected individual, you should use tissue or use your elbow. So if somebody is coughing, you will not use hands to cough. You don't use his hands to cover his cough. You use his flex or bent elbow to cover the cough, so that the aerosol will not be spread, as we seen during the transmission of disease. And also handkerchief, use of handkerchief is not advised, because if you use handkerchief, most likely you're going to return it back to your pocket. And if you return it back to your pocket, you may not, and then your hands will be infected, and you're likely going to maybe touch some objects or touch some individual, which may lead to infection. And also the third one is avoiding touching your face. Usually in your face, there are 3 areas in your face that it can be a channel or route of infection. The eyes, the nose, and the mouth. They have what is called mucous membrane. And mucous membrane are part of our bodies that have direct contact with our system. Like the eyes, if you touch your eyes, it will easily get back into your bloodstream, or the nose, it will easily get into your bloodstream, and then the virus will enter. If you touch infected or contaminated surfaces, the virus will get into your system, will get into your nose, to your blood, and then start replicating. So also because of the aerosol, or sorry, the droplet, usually is the distance. It cannot travel more than 1 meter or 2 meters. So we should keep safe distance or safe distancing, so that at least whatever you are doing with any individual, you should keep a safe distance of 2 meters, so that even if that individual is infected, when he coughs or do something that emit the virus, you are not likely to get infected. And as much as possible, what is advised is to stay at home. To stay at home, unless you have something that is very critical. And if you have critical thing, you use hand sanitizers, you maintain social distancing. And in areas that have lockdown, there's no need for you to go out unless you have critical needs, unless maybe if you're a health worker or a security island, or you are providing any critical services. So the last component, or the last item on the Take Responsibility campaign is stay informed using official sources. So if you go to now on social medias, especially WhatsApp, Facebook, Twitter, and other channels of social medias, there are so many fake news, so many misinformation about the coronavirus. Some will say that it's a conspiracy. Some people will say that they have some medicine or some procedure or some things that you can do to prevent yourself from getting infected. And in most cases, those things are not true, just made up by some individuals. So for you to have verified information, it's very important to use official sources. And the official and verified sources to be used are the WHO website and the SADC website. And based on agreement with MTN and I think Airtel, whenever you want to get any information from WHO or NCDC website, it will be free. You don't need to have any data. If you don't have data, you can log into the WHO data. Even if you don't have data, or even if you have data, when you want to go get some information, NCDC or the WHO website, it will be free, because every day the network provider provides about 100 MB for you to get information on the coronavirus. So we should avoid fake news as much as possible. So another key component, or one of the most important components, is hand washing. But the hand washing is not ordinary hand washing. It's not just go to a tap or use soap and water to start washing your hands. There are procedures of hand washing, and then the hand washing should last for at least 40 to 60 seconds. So the first thing you do when you do hand washing, maybe let me just do a demonstration. There are 11 steps. First, you wet your hands with some water, and then you apply the soap, and then you rub your palms with waters, and then rub your palms, both palms like this, and then like this, and then use the third step is use your right palm over the left dorsum like this, and then also you do it again, and then you also your palms, you also put them together, and then also interlace your fingers so that everything everywhere in your hands will be clean. And then the fifth one is back to your fingers to opposing palms. So like if you are, especially your nails, there are some things that may accumulate there. So you interlock your fingers to wash them properly. You also do it with both hands. And then for your thumbs, you also wash it using rotational movement for the right and left thumb. And then rotational moving backward, rotational rubbing backward and forward with grasped fingers of right hand in left hand and vice versa, so that everything will be washed. So after doing all that, you rest your hand with water, and then dry your hands thoroughly with a single-use towel. Usually, either use single-use towel or a tissue, so that if a towel is not single-use, it may be contaminated, and then even after washing your hands, you may contaminate the hands again, with, which may also have the virus. And then use towel to turn off the faucet. That's the tap of the handle of the tap. Don't use your hand because it's already clean. Use the tissue or the clean towel to turn it off. And then after doing all these things, your hands are safe. And this is the procedure of hand washing. Maybe whenever you go to NCDC or the WHO website, you can see a video of this picture and you can rehearse it so that whenever you're washing your hands, you'll be doing it properly. So one other key thing that is reigning now is use of masks. There are some people that when you go to the street, so many people will be wearing masks. However, based on recommendation by the WHO and NCDC and other reputable health organizations, it's not everybody that will use masks. If you're healthy, you don't have to use masks. Masks are only to be used for somebody that is sick. That's if he's coughing and sneezing, or somebody that is taking care of sick persons or health workers. And then if you have to wear a mask, you have to do it properly, because if you didn't do it properly, you, instead of getting protected, you can use your mask to get infected with the coronavirus. So now how do you wear masks? So before putting on a mask, clean your hands with alcohol-based hand rub or soap and water. You wash your hands with soap and water as described earlier. You cover your mouth and nose with packs and make sure that there is no gaps between your face and mask. And then avoid touching the mask while using it, because if the mask is expected to protect your mouth and nose from the virus. So, but if you're touching it, probably you may get exposed to the virus, and then the virus may land on the mask. But if you touch the mask, you may likely get those virus on your hand. So, whenever you touch your hand, it's advisable that you wash your hand with handcloths, with alcohol-based hand sanitizer, or with soap and water. And then you replace the mask when it gets, and then the masks are usually single use, so you don't repeat it. You can wear masks today and be keeping wearing it. And even in a single day, you can use several masks, because whenever a mask is damped, there's no need for you to use it again. You replace it with a new mask. And when removing masks, it's very important that you do it properly. When you remove masks, you don't touch the front aspect of the mask. You only touch the back, the string of the mask. Just remove it, and then don't touch without touching it. Put it in a closed bin, and then immediately go and wash your hands with soap and water. So for persons that are sick, you stay at home, avoid public places, avoid public transport, and then avoid public transport. So somebody that is sick, he only needs to go out unless when he needs medical care, because whenever he gets out, he will likely get in contact with persons and he may get infected. So before I finish, there are some misconceptions about the coronavirus that are very important for us to dispel. So that can the coronavirus be transmitted in areas with hot and humid climate? There are some people that will be saying that because Nigeria we're in the hot season, that the coronavirus cannot transmit here. There's no evidence that the coronavirus cannot be transmitted in season. In fact, we have evidence that it's transmitting, because there are some Nigerians that have never traveled but become infected with the coronavirus. So the virus can be transmitted in hot and humid environment. And then another misconception: does taking a hot bath prevent somebody from getting infected? It doesn't prevent somebody from getting infected. And then another one is, how effective are thermal scanners in detecting people infected with the new coronavirus? If you go to so many places now, public places, they will have infrared scanners. So those scanners, they will detect persons with fever, because one of the cardinal signs of the COVID-19 virus is fever. So anybody with fever will not be allowed to enter those areas, because they may likely to be infected and they may share the infection. And then can spraying alcohol or chlorine all over your body kill the new coronavirus? That this is a very dangerous misconception. In fact, some people are even taking the alcohol-based hand sanitizers or other disinfectant. They will just drink it, or some people will just take bath with it. This has not. There's no basis. There's no evidence that this could protect somebody from getting infected with coronavirus. And then are younger people spared by the virus? No, younger people can be infected with the virus. Only that so the severity of the disease is higher in older age group and people with pre-existing condition. However, in Europe, in China, there are several young people younger than 30, people younger than 20 years that become infected that died because of the coronavirus. So just because you're young, you are not immune to get infected. You are not immune from dying from coronavirus. Antibiotics effective in preventing and treating the new coronavirus, as explained earlier. There's no antibiotics or antimicrobial or antiviral against the coronavirus. So far, the most important thing is for you to prevent yourself from getting the disease. So these are some of the common misconceptions, especially in Nigeria. This was also released by NCDC as part of the Take Responsibility campaign. Like some people believe taking lemon, some WhatsApp broadcast, they will say that if you take certain quantity of lemons, that it kills the virus. This is not true. There's no evidence that this lemon kills the virus. And then some people say that eating garlic and ginger does not eliminate the coronavirus. There's no evidence that garlic and ginger eliminate the coronavirus. But the most important thing, even though garlic and ginger are healthy food, but they have not been shown to be effective against the coronavirus. Some people also think that gargling warm water with salt kills the virus. This one is also a misinformation. It's a disinformation. There's no evidence that gargling your water with salt and water kills the virus. So you may actually harm yourself in the process. So in some people, they will say that they have some special oils. They will say that it prevents the getting infected. This is not true. There's no evidence to show that there's any oil that prevents somebody from getting infection. Some people even go ahead to drink Dettol or other dangerous chemicals because they want to get protected. All these things have been shown not. There's no evidence that those things can prevent you from getting coronavirus. The most important thing are those 6 steps that we mentioned. If you follow them religiously, you are not likely to get infected with coronavirus. So the last thing, the take-home message, or in conclusion, the COVID-19 outbreak is real, deadly, and is spreading rapidly. However, there are some practical ways you can protect ourselves. Our current low number of cases in Nigeria present a window for us to limit its spread. So now we have less than 140 cases in Nigeria, according to the NCDC. So if we can limit these numbers, we can identify all the contacts, we can prevent the spread of virus in Nigeria. However, there is an epidemic of misinformation and fake news raging, especially on social media, WhatsApp and Facebook. So many misinformation. So as much as possible, you should avoid getting this information and get your information from trusted source. Take responsibility to protect yourself. Wash your hands. Avoid touching places and use hand sanitizers. And then let's all be COVID-19 prevention advocates by not only protecting ourselves, but by educating others and supporting people in need. Let's say maybe health workers or any other people in the communities. Actually, because of so many misinformation, whenever there is any misconception going around, maybe if you're in a WhatsApp group, give them the right information so that people will not be taking information that will harm them. Like people that have become ill because of taking paracetamol, chloroquine or other medicine that are not effective against the coronavirus. So these are my references. Thank you very much for listening and stay safe. Thank you very much.
Thank you so much, Dr. Jamil Ibrahim Nikal, for the wonderful presentation. Our viewers, you can actually follow us through our social media handles, Twitter, Facebook, and so with this, we have a handful of questions. I would like to start with the question and answer session. And although most of the questions had already been answered by the presenter during the course of his presentation, but the first question actually asked by Adam Mustafa. He said, Adam Mustafa, he said he wants to know, why do you think the world is so much focused on COVID-19? Is it because of the transmission rates or the fatality?
Okay, thank you very much. Can I go ahead and answer the question?
Yes, you are free to.
Okay, thank you very much for the question, Adam. Yes, the world, if you look at whenever you open any news source now, the trending thing is the coronavirus. Like it occupies more than half of the news in most news outlets, the coronavirus. So why is it? Why is so much focus? But it's because of the, as you said rightly, because of it's highly infectious. It's highly infectious. Like some of the people that are infected in Nigeria, they don't even know they are infected. They don't even know that they have contact with the persons, because before you know it, when you touch a surface that is touched by somebody that's infected, you can easily get infected with the coronavirus. As I mentioned earlier, the basic reproductive rate, or the R0 for the coronavirus, is very high. So before you know it, one person can transmit it to other persons, and the other persons can transmit it to other persons. So before you know it, one person within 2 or 3 days can be responsible for spreading the virus to 10, 20, 30, or even 50 persons. And then another thing is the case fatality rate. That is the case fatality number of people that die from that have infection, that die from the disease. So far the global rate is about 5%. That means for every 100 persons that have gotten infected with the disease, 5 will die. So that means if this virus is highly infectious and you can easily get, let's say in Nigeria, our population is about 200 million. Let's say even half of our population got infected with the coronavirus, because without adequate protection measures, it's very easy. Easily people can get infected. So if half of our population, let's say 100 million people, got infected with the coronavirus, that means about 5% of them will die. 5% will be about 5 million. That means 5 million Nigerians will die. This is the modern population of so many states, modern population of, let's say, Yobe State or Enugu State or some states. So it's very important. And also it has disrupted so many activities in the world. Now you can't travel outside. So many businesses are closed. So many basic essentials are closed. So many places people are in lockdown. So as to reduce the impact of the coronavirus. Thank you very much.
Okay, thank you so much for the answers. We have the next question is from Harun Ibrahim. Harun Ibrahim said, I'm interested in knowing what may be responsible for the variation of fatality rate amongst countries.
Okay, there are so many factors I've been putting for why some countries have high infection rate and other. So the most important thing is if you look at it, maybe if some countries have the proportion of the elderly population is really high in some countries. So if maybe the elderly occupies, let's say 30 or 40% of the population of those countries, that means many of them will get infected, and because they're elderly, they can die easily. And also the health system of the country can contribute to high fatality rate. So if the health system of the country is not too strong, it may be, so many people may not get the requisite supportive care that the patients with coronavirus requires. And with that, they are likely to die because of lack of effective treatment. And then also some public health measures. If public health measures are not in place, so many people will get infected. And so if so many people are infected, even if you have a very good health system, it will get inundated, it will get overwhelmed, and some people will not get infected with the coronavirus infection. There are some countries like Germany, they have over 60%, over 60,000 confirmed cases, but their fatality rate is still less than 1%. This to show that the health system is very strong, and they've been able to cope with the virus, and the public health measures is also acting very well in their favor. Okay, thank you.
Okay. The next question is from Noura Idris. He had actually 2 questions. He said, we are always told that COVID-19 doesn't have medicine for now. Can you please elaborate on the method of management currently adopted for it, considering its fatality rate?
Okay,
although
this is a
it has already
very,
been answered during the conversation.
Okay, this is a very important question. So far, what the WHO and other authorities globally are saying is that there is no non-effective medicine for coronavirus. There is no non-effective against the virus. So the most important thing to do is to give supportive care, supportive management to people that are infected. So based on the symptoms, so if somebody is having fever, as I mentioned earlier, you'll be giving drugs for the fever. If somebody is vomiting, or if somebody is vomiting or is having diarrhea, that person is likely to be dehydrated. And if he's not hydrated, he may die from dehydration. So he'll be given fluid therapy. If somebody is having respiratory distress, he can be given oxygen, depending on the severity of the respiratory distress. So, but if his lungs is severely affected, sometimes he may need ICU care, intensive care unit. And unfortunately, in Nigeria, we have very few intensive care ICU beds capacity in the country. So many people that may require ICU may not be ICU care, may not be able to get ICU care. So people that have severe disease may require ICU care. So if somebody is having acute kidney injury, that's a renal failure, acute renal failure, that person should be should undergo dialysis to give supportive care before viral infections like catarrh, common cold, usually is caused by the influenza virus or other class of virus. They're usually self-limiting. After some time, the virus will stop replicating or it will get well out of your body and it will be virus-free. So the aim of the treatment is just to give supportive management or supportive care based on what the symptoms or the sign the patient present until the virus went out from the patient's body. Thank you very much.
Okay, thank you. At the same time, Nura Idris is also asking of your the debate on chloroquine as
Okay, chloroquine. I think about the debate on chloroquine as cure for COVID-19. What is your take? My take is the take of what I would say is most researchers, most authorities. So far, the WHO, as I mentioned earlier, stated that there is no evidence that chloroquine is effective for coronavirus. There have been some studies in France. I think they used about 40 patients and they gave them chloroquine for the coronavirus. But those studies, usually to do a study to confirm whether a drug is effective or is not about a particular disease, there needs to have a high level of scientific study, referred to as randomized trial or randomized control trial. So for the study that was done in France, it's just an observational studies. There are several studies. We have observational studies, and then we have experimental studies. So observational studies, even though you can get some information from it, but actually those information are not enough for you to make a categorical decision that that thing is. So you can use it maybe to generate hypothesis that, yeah, probably chloroquine may be effective. But however, you need to test it. You need to randomize it. Randomize it is that like that chloroquine is not randomized. The study that was done, they just sample patient and just give them chloroquine. As we all know that 80% of those cases, 80% of those cases are either mild or even no symptoms. So if somebody is having mild symptoms, so even if you give him chloroquine, that chloroquine, even if it doesn't work, you're not likely to get anything. But for randomized control trial, you match cases and then what is called control. Cases are people that maybe have the disease, and then you match them against either a placebo, a drug that doesn't have any effect, or another drug, and see whether the effect of that drug is due to that drug or due to other factors. Because if something is not randomized, there is the higher chance of what in scientific studies referred to as bias, or maybe you select people that you think they will do well, maybe based on their age, maybe they are younger persons or they don't have other underlying conditions. So, but in randomized trial, you take all factors into consideration, so that at the end of the day, whatever may be the result of the study, it will be that whatever may be the effect of the drugs, it will be is that effect of the drugs, not other confounders, or maybe that maybe that may be introduced during the course of the studies. So far, chloroquine has not been approved by WHO and by Nigerian Center for Disease Control for the treatment of COVID-19. However, there are some studies some trials that is going on in so many countries using the highest form of scientific evidence, that's randomized controlled trials to test whether chloroquine will be effective or not. In the next few weeks, I think probably a few months, results will be out and we'll know whether chloroquine is effective or not. But for now, chloroquine is not effective for the treatment of COVID-19.
Okay, thank you so much. We have another question from Abubakar Siddiq. He's asking, what is global success story of handling the spread of the virus, looking at the fact that the world giants like United States of America, Spain, and etc. cried out for help?
Okay, I think this is also a very good question. What is our lesson? What are the success stories? So many countries are affected by the coronavirus in almost all parts of the world, in Europe, in Asia, in the Middle East, in Africa. So for us in Nigeria, I think the take home is to see what the countries that did well do and were able to reduce the number of cases and deaths in those countries. Like in China, where the whole pandemic started, they used to have the highest number of cases, but as I mentioned earlier, yesterday they recorded less than 80 cases in China. But in other countries, they're reporting hundreds of thousands of cases on daily basis. So what is China doing? So, but what they're doing is not actually rocket science. It's what other countries have adopted: strict lockdown, restriction of movement, so that only people that have so many things, important things to do, will be allowed to go out. Like in China, they have started even using some intrusive mechanism. In fact, anybody that you'll be given a sort of passport that you must have some clearance, that you don't have fever, you don't have based on their information from your mobile phones and other applications you visited, whether you have not been in contact with any or with somebody that is infected and you don't have fever. So this will give you a pass for you to go out. So these are the things that I think these are the success stories. So what is China doing well? The lockdown, the aggressive care, mobilization of resources to build health facilities. If you remember, during the peak of the epidemic in China, they were able to build one hospital health facility in less than 2 weeks. So these are the things that we can adopt. And in Lagos, I think something similar has happened. I think this is one of the success stories we learned from them. And then in countries that didn't do well, actually what happened is that in those countries, there are some countries that are bigger names, but initially they are in denial. They think that the virus will just clear around or the virus will not reach them. And then when the virus reached them, it hit them harder. And whenever you have higher cases, for you to control, it usually takes some time. So for even after lockdown, they said even after lockdown, what experts said, for you to start recording reduction of number of cases and death, you need to have like 10 to 14 or even 15 days of lockdown for you to start having reduction of number of cases. So the most important thing is for you to act fast, to act decisively, and then to use experience from other countries like China, like Singapore. They also did well, like Germany, to respond to devise appropriate response measures for the coronavirus pandemic. Thank you very much.
Okay, thank you so much. We have another question from Shikaro Emmanuel. He said, what is between, although you have already answered during the course of your presentation, the link between the BCG vaccination and immunity against the virus in some countries?
Okay. There are some studies that have been done, though not elaborate studies that were conducted. And on those studies, some preliminary studies are showing that people that have BCG have some either mild illness or are somehow protected from the coronavirus. However, what is advised is for us to have a larger study. We can't use that studies to make a conclusion that BCG is protective. And that's why the WHO or NCDC would not come out and say that BCG is protective against. We need more evidence, and for now, several countries at several centers have started doing some studies to see how whether BCG is protective. However, for us in Nigeria, I think it would be a good news if BCG would be protective, because most of us at birth, we are usually given BCGs. And if you have BCG, if it is protective, I think Nigeria will have the burden of the COVID-19 will be far lower than in countries, especially in those developed countries that don't have tuberculosis. BCG is really given to children to prevent them from having tuberculosis or severe form of tuberculosis. So, but because those countries don't know they have tuberculosis, so they don't think that this is necessary for them to have BCG. But because we are still tuberculosis, one of the top countries that are endemic for tuberculosis, BCG is still given at birth. So if it turns out to be very effective, I think many Nigerians will benefit from the effect of BCG against the coronavirus. But for now, there is no evidence, or the evidence that we have is very limited. There is need for us to have broad studies, more detailed studies to know whether BCG is effective or not. Thank you very much.
Okay, thank you so much. We have a question, Ibrahim. He's asking of duration of infectivity. Viral shedding is of particular importance. Does it mean isolation of confirmed cases should be at least 37 days for mild cases if retesting can be afforded?
Yeah, yes, the viral shedding is usually between, as I mentioned earlier, 17 to 25 days. Usually people that survive, they shed the virus for 15 to 25 days. So it's during the period of virus shedding that they can transmit the virus to other individuals. The highest that was recorded was, you mentioned rightly, 37 days. So however, anybody that has the virus should be treated as a special designated isolation centers. However, in countries that have higher number of cases, they only admit cases that are, like Nigeria, because we have fewer cases, we admit virtually most cases at treatment centers. But in countries that have large number of cases, people with mild disease, those 81%, they are advised to stay at home unless they have serious illness that can be a threat to their lives. So for persons that are infected, especially those at the treatment centers, if you remember in Nigeria, the Italian was discharged and a couple of other people were also discharged after getting cured. So the criteria of declaring somebody is cured from coronavirus is when after doing 2 consecutive PCR, at least 24 hours apart. And if they are both consistently negative, that person is negative, that person is not infectious, no longer infectious, and is cured from the coronavirus. However, one very not too pleasant news that was detected in China and other countries is that there are some individuals that were tested to be free of the virus, and then later they were tested positive again. But however, the vast majority of the persons that were infected, once they are declared cured, that's after the 2 consecutive PCR testing, they will be categorized as pure, and they have cured from the virus. They will not be shedding the virus, and they can go home. So one doesn't have to wait for 37 days. Once the person is non-infectious, and then a test has been done and is negative for 2 consecutive negative after 24 hours, he can be discharged. He's cured from the coronavirus, unless maybe he gets reinfected again.
Okay, thank you so much. We have a question from Hussein Moisli. He said, excellent presentation. Please, can you shed light on our country level of preparedness, especially at the community level?
Well, I think this is a also very important question. The COVID-19 situation, even though countries have been preparing for pandemic for long, there is this global health security strategy, and they did some rating, I think 2 or 3 years ago, where they rated countries to see which country is prepared for pandemic or not. So, but from what we're seeing now, even the countries that were tagged to be well prepared for pandemics, they're having problems with pandemics. But for us now, the critical thing is for us in Nigeria, what are we doing for the COVID-19 pandemic in Nigeria? So the COVID-19, the agency in charge of the COVID-19 pandemic in Nigeria is the National Public Health Institute of Nigeria. That's the Nigerian Center for Disease Control, NCDC. And I think since the DG of the Director of the NCDC, because from the outset of the pandemic, even when it was not declared a pandemic, Nigeria was identified as one of the hotspots, one of the possible hotspots where the virus can, because of our population and because of the frequent travels we do, Nigerians travel to Europe, America, to China, and other part of the countries, we've been identified our hotspot. So the DG, the Chikwe, was part of the team of experts by the WHO that went to China to study the virus and what the Chinese have been doing. And since then, a technical working group, and then later on, an emergency operations center has been activated in the Nigerian Center for Disease Control. And they've been training health workers and sensitized states through the state epidemiologists and state ministry of health. So in terms of our preparedness, I think for now, if you look at the media, there are a lot of information that is going on in the print and electronic media, on social media, NCDC website, NCDC platform, and other state ministry of health. There have been some kind of community sensitization activities. And then with regards to preparedness, so many states have set up isolation centers. Like almost all states have isolation centers. I know Lagos have isolation centers even before the onset of the first case. FCT in most states actually have isolation centers. And because of the anticipated, even though we don't pray that we may have a very big outbreak, states have been advised to increase their capacity of the isolation centers. Many states have procured so many equipment, drugs, personal protective equipment to prepare for the pandemic. However, one critical thing that I think that needs to pay attention is the issue of risk communication. It seems like up to now, there are a lot of misinformation going on, as I mentioned earlier in the presentation. So many people are not informed. It's only people that are usually enlightened, people that can watch news, people that can use newspapers, that are on social media, that have some of the key information. If you look at if you go to communities, especially our towns or in the slums and the villages, there are still some people that are living in denial that they don't think that there is coronavirus. So it's our responsibility to educate those people in the communities on the coronavirus and on how they can protect themselves. Because if somebody is not protected, even if you're not protected, one way or the other, he can put you at risk and you may get infected with the coronavirus. So regarding preparation, even though so many things have been done, I think more can be done by the country, and by the states. And I think because of that, the president, I think, released about 6 billion naira to NCDC and about 10 million naira to Lagos State government to also prepare very well, buy equipment, train health workers, ramp up surveillance to see how we can stamp out the COVID-19 pandemic in Nigeria.
Okay, thank you so much for the. We have the next question. Although you have already answered the question, but maybe briefly you can just say a few words. What is the international practice in certain isolation centers? Because we can see in Nigeria, centers are only located in few regions.
Yes, it depends. Sometimes it's based on needs. Ideally, even before the onset of the COVID-19 pandemic, each states were encouraged to have isolation centers because we have so many diseases like Lassa fever that is very infectious, and there's some diseases that need like Ebola. We had Ebola some 6 years ago that needs some isolation. So all states are encouraged to have isolated centers. But I agree with him that there are only few isolation centers that we have in the countries. So even internationally, they don't actually have those treatment centers. What they usually do, what they do is that whenever in places they have isolation centers, they increase the capacity of their existing health facilities, build makeshift hospitals that can serve as treatment centers, and in some cases even mobilize health facility workers from other parts of the countries. Let's say if Lagos State is infected and have high number of cases, they can mobilize doctors maybe from Kwara State, from Osun State, that will come and build up the capacity of those centers. So, but isolation centers are some maybe what we need before, maybe after the pandemic, is state to have isolation centers. But when we have full-scale isolation centers, definitely there will be need for us to have makeshift centers. And for now, the president has directed that so many federal facilities like the stadiums, other federal buildings should be converted to emergency treatment centers, so that even if our health facilities are overwhelmed, we have places that we can treat, especially those that don't need critical care. Those that need critical care will definitely be managed at designated healthcare facilities that have all the gamut of treatment, like ICU, ventilators, and other dialysis centers that people with severe disease will require.
Okay, thank you so much.